All right, the topic in health, not one a lot of middle-aged women want to talk about, but it's likely that she's dealing with one of the most frustrating aspects of aging, hot flashes, which means menopause. It's also the single most dramatic risk factor for heart disease, stroke, diabetes, obesity, and osteoporosis, all things that I did not realize. Joining us to talk about is Dr. Sabrina Fabi. Dr. Fabi, thanks for being here.
Thanks for having me, Jen.
All right, so menopause typically occurs around the age of 50. What is really happening to a woman's body when she's sort of transitioning out of those childbearing years?
Well, essentially the ovaries are aging, and our ovaries are organs that secrete estrogen and other hormones. And so as those hormones decrease, because the ovaries function decreases with age, and this can happen anywhere between the ages of 45 and 55, then this affects the overall system of a woman. And it can manifest as hot flashes, which is probably the most frustrating thing for women to deal with, because they go through these chills. Sometimes they don't even get the hot flash necessarily. Their whole face and even neck and chest sometimes turns red. And it can also be cosmetically disturbing for women, and that's something that I commonly treat very much. But it's not just hot flashes, it's also bone loss. And so I start to see it as early as the age of 30, but when you go into menopause, it exponentially increases. And so we commonly think of it as a hip fracture, but what we really see, at least in my practice, is the changes in the face.
Right.
And because of all the bone loss that you get, you lose the structure to support all the fat and skin that you have on your face.
Is that essentially because the changes in our estrogen levels?
Yeah, so estrogen is a driver for bone growth. It also regulates the hypothalamus, which is a part of the brain that regulates our overall temperature control. And it does more than just that. It also helps with mood. And so women will also experience mood disturbances during menopause. But the greatest single risk factor is really heart disease. And it is the #1 cause of death after the age of 50 in women in the United States.
It is, for men and women. All right, talk to me, Dr. Fabi, about some things that women can do to sort of ease this transition, things maybe to reduce some of those symptoms.
Yeah, and so I think that women most commonly think that they just have to endure this, and that's not necessarily true. I think seeing a good endocrinologist, maybe starting with your primary care physician, but then seeing an endocrinologist about whether you're a candidate for hormone replacement therapy. There was a large study that confirmed that with supplements of both estrogen and progesterone, soon going into menopause within the first year really decreased that incidence of heart disease. It promoted bone growth, so it decreased the incidence of osteoporosis, and it also decreased mood disturbances that women experienced. But doing other things to supplement, such as making sure that you have good vitamin D and calcium intake, because you don't want to do anything that's going to add to your bone loss. Also making sure that you brush your teeth twice daily and that you floss regularly, because you don't want to lose your teeth in your face. And you also, if you have gum disease, that will increase your risk of heart disease. And then probably the most important thing is to regulate your sleep, because when you don't sleep, you increase a hormone called cortisol, which also breaks down more bone, and that's something you can't quite afford to do. And so making sure that you're regularly doing things like exercise to promote good sleep, so that you combat also the increase in weight that can come with menopause.
Well, I will say my mom said going through menopause, at least now with no children in the house, she finally can sleep through the night without worrying about her children. So that's good.
So that's a plus.
Yes, Dr. Fabi, thanks. Always good to have you in the discussion.
Thanks for having me, Jen.